Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest highlighted to us is the upper left 3, 4 and the 5 region. The upper left canine appears to be doing well, but the upper left first premolar has a periapical pathology associated with it. The buccal cortical plate is absolutely missing. The upper left second premolar implant placement. The implant generally looks okay, but the mesial aspect shows signs of bone loss. It could be associated to the 4 or it could be an individual periodontal lesion affecting the 4 and the 5 simultaneously. Now, this is the sagittal view. Here we can see that the implant has been placed. We see a periapical radiolucency associated with the 4. Moving on to the transaxial view. On the transaxial view, we will first discuss the upper left canine. The upper left canine has a hypodense area on the palatal aspect, which is very closely associated with the pulp, but has not invaded the pulp yet. We've got one single canal in the upper left canine. The single canal appears to be doing, there's no multiple canals here. The working length of this tooth approximately is going to be 26.5 millimeters. Moving to the upper left second premolar, the first premolar, my apologies. The upper left first premolar has a major periapical radiolucencies, has endodontic treatment done. There is a split fracture segment in the palatal aspect, and we can also see that there is root resorption around the apex, the interradicular area, and this is where the crack is propagating from the crown all the way down to the into the interradicular and the dental spaces. So this tooth is not doing very well. It has a periapical radiolucency and has root resorption and has a fracture present within it. Moving to, this is the distal aspect. We can see that there is significant bone loss associated and a periodontal lesion in the interdental spaces associated with the between the 4 and the 5. We've got loss of cortical plate, buccal cortical plate. Now moving to the implant surface. On the implant surface, we can clearly see that this is the implant. The implant is placed slightly buccally but doing generally well. We don't see any periapical pathologies or pathologies on the palatal aspect, but we do see buccal bone loss. The threads can be seen visible here. We can also see that on the mesial aspect, there is a radiolucency associated with the implant. Now on the axial view, this is a view which will show a little bit more of detail and a little bit more clarity to our doctor. Here we can very clearly see that this is the crown structure. This is the, as we are moving down, we can see that there is bone loss associated with the implant on the buccal surface and on the mesial surface. Here is the fracture segment, which we can see very split, and the radiolucency is actually extending to the palatal cortical plate as well. The buccal cortical plate is gone. It hasn't involved the canine yet, but this is where the fracture can be seen very visible. We can also see that the implant is doing well on 3 surfaces, but the buccal as well as the mesial surface, we can see there is bone loss, which can be seen on the axial view as well. So if there are any further questions regarding this case, please feel free to reach to our team. We will be extremely happy to help. Thank you very much.